Well, good afternoon, everybody. Thanks for joining us. So I want to welcome everybody to the first in a series of two webinars hosted by Big Sky Care Connect, Montana's premier health information exchange. My name is Kurt Swenson, and I'm going to be facilitating today's webinar. It's great to see some familiar friends online with us today. Before we get started, a couple of things. I'm just going to ask everybody to keep yourself muted unless you're talking. And if you have questions along the way, please use the chat feature just by clicking on the chat button and typing your questions in there. Kelly is going to be behind the scenes helping us on the technical side. And as I pause throughout today's webinar, she'll be letting me know what your questions are, and we'll have a couple of opportunities to answer questions for you. So moving along, our agenda today, here's what we're going to cover. We're going to give you a brief overview of where we're at with the Health Information Exchange today by talking a little bit about the value of the HIE, how it's working today, how it will work in the future, and a little bit about service expectations you can expect from Big Sky Care Connect. After that overview, we'll have a quick pause for some questions, and then we are excited to be bringing an excellent panel of your peers to discuss the value of an HIE from their perspective. And then at the end, when we have a little bit of time, we'll also have some time for questions and answers. So I'm going to dive right in because I want to give the panel plenty of time to visit and to have you hear directly from your peers. I'm going to start just a little bit with why is a health information exchange in Montana valuable? So I want you to think a little bit about some common healthcare scenarios that are listed here on this screen. These aren't unusual for any of you, and they happen regularly. And the big question is, when scenarios like this happen, where can you go quickly get the information you need about a specific patient to give them excellent care at the point of care? How do you know what's been happening with those patients since the last time you've seen them? Where else have they gone? Have they seen a specialist? What medications are they on? Have they received new diagnoses? And when we think about the continuum of care, what's the best way to coordinate transitions and coordinate care across the spectrum? The HIE is actually going to give Montana the interoperability that we really need to efficiently manage all of our patients in Montana, but especially our most vulnerable patients that we see on a regular basis. The Health Information Exchange is really also going to improve the flow of health data across all silos of care in Montana, from hospitals to primary care to behavioral health, and even through our independent providers. It's also a tool that we believe is going to assist your providers to become much more effective, efficient, and productive, while also giving Montana patients the absolute best care possible. One of the components of healthcare in Montana today is that there are many, many points of care. And when you think about all these points of care and who you interact with regularly, and the time, the labor, the inefficiencies, and even opportunities for error as you're interacting with and communicating with all of these points of care, wouldn't it be awesome to have all of those points of care connect in a single place, where with just a click of a button, you can go understand and see the data about any given patient right there on the spot? And that's what the health information can really bring to all of our healthcare providers in the state. I was recently talking with a CEO of a large clinic in Montana. And one of the things he told me was that he had 3.5 FTE dedicated specifically to sending and receiving records to all of these points of care. And one of those FTEs was even a nurse. And we were talking about, for him, the value of an HIE would be that he could truly reallocate those resources so that the nurse could be a nurse and that his other staff could be doing other more productive functions within his clinic. And it's these kind of nuances and efficiencies that health information exchange has the opportunity to bring to all of us in Montana. When we think about the specific value to hospitals of a health information exchange, we know that Montana is one of only 2 states in the nation that doesn't have a health information exchange. And that is some good news for us because we've got lots of other states to rely on for data and research. And the literature is really clear. Health information exchanges help hospitals improve the quality of their patient care. It helps hospitals become much more efficient with their resources and cost management. And finally, and most importantly, it allows hospitals to improve patient outcomes and improve patient satisfaction in their interactions with hospitals. Now, there's a lot of bullets here on this slide, but this is just what the data tells us from other states' HIEs who have been utilizing these tools for several years now. So here's the big question that gets asked, and this is the elephant in the room, if you will, in some regard. And many of you know that Montana back in 2016 attempted to build a health information exchange, and it didn't go great. And the question we oftentimes get asked at Big Sky Care Connect is, so what's the difference? Like, how is this going to be any different? And are we going to go through the same amount of work with the same result? Well, the answer is no, and here's why. The first big difference from previous attempts at an HIE is the funding. Big Sky Care Connect has acquired a 90/10 matching grant through High Tech that is significant enough that it will cover all of our onboarding costs through September of 2021. The onboarding costs that aren't covered through that grant would be any costs you might incur from your EHR for integration. And we also have funding available through our network interoperability program to assist with those costs as well. So the financial risk to join the HIE this time has been made very, very low. And in addition to that, the costs for sustainability beyond September of 2021 are very affordable, and I'll get to that later. Another big difference this time around is our board of directors. We have a very diverse, influential board of directors made up of many CEOs, made up of a lot of thought leaders in Montana healthcare. We've also implemented an advisory committee structure, which really means that you, the hospitals, and the healthcare providers in our state have a big voice in what this HIE looks like and what it's going to do for all of us in healthcare in Montana. A huge difference from previous health information exchanges is the technology. And we've partnered with InterSystems, which is a global technology leader in healthcare. In fact, InterSystems is the health information exchange provider for many other states' health information exchanges. And they have a proven track record of not only service, but effectiveness. InterSystems has won many awards for their lack of downtime and awards for their customer service. Another big reason that we believe it's different this time is because we've learned a lot of lessons. Failure is oftentimes a great teacher, and we've learned from not only the attempts that we've had in the past, but by listening to all of you. Many of you heard from Gene and the health tech team last year as they traveled around the state and talked to you. And believe me, they listened. And many of the suggestions and lessons learned from the past were brought back in and are being implemented as a part of this health information exchange's implementation. Finally, we've received endorsement from the governor for this project and have the governor's office full backing. So those are the highlights of what's really different this time than last time. And so the next question that we need to answer is, all right, so how's it actually going to work? What's going to be there, and how is this going to integrate, and is the data going to be safe, and those kind of questions. So let's start with that. Let's start with the data. One of the things that we're awfully proud of is the privacy and security measures that have been put into place for the health information exchange this time. We know that the data is going to be very secure. It's all going to be encrypted at both ends, giving and receiving of data, and even when that data is at rest. It's also going to comply with all national standards for security, and privacy. We also have a very robust access management where users are granted access only according to their role that is given to them through their EHR or their organization. We know that payers are going to have limited access to only their eligible members, and that single sign-on is going to be implemented with user authentication services. And we also have robust tools to tightly manage access to the data with ways to track it and audit who accesses what. Finally, the participation agreement that you'll all sign when you sign up for the Health Information Exchange ensures that all participants are governed equally and no user has any unique advantage over another. We all know how complex and difficult integration with EHRs can sometimes be. And we're not here to guarantee you that we're going to make it simple for every single EHR integration, but what we have done at Big Sky Care Connect is done everything we possibly can to make sure that your integration goes as smoothly as possible. And we've done that with several different things. We've created different access options. So if you want to access the Health Information Exchange, you can do it one of three ways. You can do it through single sign-on, which just means that as you're working in your EHR, you could click a button in your EHR to the HIE, and you would be taken directly to the Health Information Exchange without any additional login or password, and you would be taken directly to that patient's record that you're looking at on the HIE. With direct query access, it allows you to truly integrate with your EHR, whereby clicking on the Health Information Exchange, it actually pulls the patient's data directly into the EHR for you to view. And finally, for those that choose not to have full integration, we do have a web access option that allows you to access the state's HIE through a web portal that is secure, just like you would access any other web applications. We have several secure connection options, both VPN and HTTPS. And our data exchange options are also likely to integrate with any EHRs using standard integration types and versions. So how much is it going to cost? What is the HIE actually going to cost my hospital or my organization? And we want to be really transparent with you about what those costs are. As I mentioned earlier, there are no costs for you to participate in the Health Information Exchange until after September of 2021, other than your EHR's integration costs. Essentially, you're going to have free access until that time. After September of 2021, we've done our level best to ensure that this is an affordable option for everyone. As you can see on the chart posted right now, there are costs that are tiered for hospitals based on net patient revenue, and those costs are listed in the cost per year column in the middle. And then the additional costs are your provider fees. So it's $144 per provider, which just means a provider in your hospital that can bill $144 per year. And so if you think about, if you take a tier 6 hospital, for example, and let's just say, because I'm bad at math, that we have 100 providers in that hospital, a tier 6 hospital with 100 providers would pay $32,400 per year to be a member of the Health Information Exchange. So with costs being very affordable and costs being very, very low up front until September of 2021, we've tried very, very hard to make the financial risk for your participation to be very, very low. The next thing I want to address is what's available, what's coming in our go live date in September, and what will be available in future iterations. So here's what we have going right now at Big Sky Care Connect. Right now, we're working with over 40 different facilities in our outreach process, talking to them about coming on to the Health Information Exchange. We have 6 facilities and Montana Medicaid program already in the process of testing and onboarding onto the system. And the facilities, by the way, just for your curiosity, that are already signed on, are Billings Clinic, Rimrock, Advanced Care Hospital, Youth Dynamics, Riverstone, Cabinet Pete Medical Center, and of course, Medicaid of Montana. In the meantime, we're also in the process of doing a lot of testing of different systems, and we plan to go live late August, early September. So just a few short weeks away, we'll be going live. And what will be available when we go live? Well, over on the right-hand side of the screen, it talks about the specific tools that will be available to you immediately when we go live. Those include longitudinal patient records, a provider portal, bidirectional exchange of patient data, consent management, sensitive code sets, encounter-based notifications, emergency department alerts for all hospitals with emergency departments. So in essence, we'll be connecting all of our Montana emergency departments together. We'll have direct secure messaging, and we'll have medication history available for you at your fingertips in just a few weeks. Coming in future enhancements, the first exciting piece is eHealth Exchange. And eHealth Exchange is a tool that might even be ready as soon as go live. It may not be, but if it isn't, it'll be coming soon thereafter. And it will allow you to have access to patient data from any state that participates in eHealth Exchange. So a patient who goes out of state on vacation and receives care and comes back, you would have access to that, or a patient who came from a participating state to move to Montana, you would have instant access to those as well. In the future, eHealth Exchange would also allow you to have access to VA and DoD health records. However, they do have some pretty intense requirements for quality and quantity of our data, which means that the more participants we have in our HIE, the faster we can have access to that information. Coming soon after eHealth Exchange will be Prescription Drug Monitoring Program, Image Exchange, and Analytics. And then down the road, we'll also be adding care management, quality measures, and a public health gateway.
Hey, Kurt, this is Kelly.
Yeah.
We do have a question. Is there any way that you could go over the cost for independent provider organizations, or do we have that information right now?
Yeah, you bet. So on these costs, provider-based clinics, which includes FQHCs and behavioral health, would be $288 per provider per year for all providers employed in private practice for that clinic. So I just want to finish with this sentiment that Big Sky Care Connect has really dedicated itself to providing outstanding service to ensure that your hospital truly receives the attention that you deserve and the assistance and engagement that you deserve from Big Sky Care Connect. On our call today are our outreach coordinators, Young, Stephanie, and Haley, and they're going to be here with you and partnered with you from the very first outreach you make to the Health Information Exchange all the way through your journey to ensure that you're getting customized service for your hospital throughout the whole process. Finally, just a reminder that the big difference for the Big Sky Care Connect Health Information Exchange is really that we're dedicated to improving patient and provider experience. We've heard for many years how important provider recruitment is in Montana, especially for our critical access hospitals. And we also have heard lots about provider burnout. And we know that the #1 contributor of provider burnout is administrative burden. We believe the Health Information Exchange can take a huge burden off that administrative load of our providers. We're going to offer access to secure, comprehensive patient information, connect the entire care continuum, and provide valuable information at the point of contact and at the point of care with all patients. And finally, through efficiencies, we're truly going to help improve your bottom line in hospitals all across the state. So with that, I'm going to pause for a minute and see if there's any questions about any of that information that I quickly covered, and then we're going to get to our panel discussion. So what questions do you have for myself or any of the other experts we have on our webinar today from Big Sky Care Connect? Kelly, anything showing up in the chat?
We do not have anything as of yet. Oh, here's a question. Can you explain specifically for the web portal access how you will follow HIPAA? Specifically, if I am a private practice provider, how do I prove I should have access to a specific patient's information?
Great question. Thanks. So Jeanette Polishek is on our team, and she's a subject matter expert with Big Sky Care Connect. And Jeanette, could you unmute and help answer that question?
Yes, I think I can. Hi, everyone. So for HIPAA compliance, Kurt talked about the user roles that we have available so that we make sure that everyone has access to just the information we need. And we do have a role for privacy officer that's based within the organization, and that organization will have access to all the audit files for their organization so that they can monitor activity for their users.
Thanks, Jeanette. If you would like to follow up on that question and get down into the real details of the technology side, we do have a great contact that we can refer you to. Please reach out and we'll put you in contact with our tech folks that can talk all of that language that I don't understand. So how about that? Awesome. All right, so let's move on to our panel presentation. Today, we have several panelists that we are just honored that they were willing to come and talk to all of you a little bit about their views on why the health information exchange is going to be important for them. I'm going to ask our panelists to go ahead and unmute themselves, and if you would be so kind, and you're not in your pajamas, maybe even turn on your cameras so people can see you. That would be great. So our panelists today with us are Dr. Kara Harrop. She is the Chief Medical Officer at Monida Health. We've got Dr. David Lechner, who is the CMO at Blue Cross and Blue Shield. Dr. David Mark, who is the CEO at Bighorn Valley Health Center. Judy Powers, the CEO of Advanced Care Hospital of Montana. And Dr. Randy Thompson, CMIO at Billings Clinic. So I'm going to turn off the screen so we can see our panelists today. Again, thank you, panelists, for joining. I'd like to just start with a general question and have you all discuss from your own point of view and from your own perspective. And the general question is this: why do we need an HIE in Montana? So let me start with Judy. Would you kick us off with this conversation and talk a little bit from your CEO seat why you believe we need an HIE in Montana?
Absolutely, Kurt. So let me start by saying a couple of things. First of all, we are a long-term acute care hospital, and we are the only one in the state of Montana, and we are considered a post-acute care provider. So we service a very unique and different role within the continuum of care. Patients are inpatient, getting services provided by a physician for somewhere between 20 and 45 days, and then we discharge 100% of our patients to another level of care back to home. So we have many hospitals within our system, because we have hospitals in numerous states who work with an HIE currently. And so I've been polling some of the other CEOs on what is the value proposition to a long-term acute care hospital by participating with an HIE. And then I'll talk a little bit about why I believe it's important in the state of Montana. So first and foremost, it's access to information that we don't have. We're an independent provider. We're not a part of a major system. And so therefore, for us to get good information to provide care for patients, we need to be able to access that information. Oftentimes, we'll just get records from the acute care hospital that sent the patient to us. And these patients have multiple comorbidities and have most of the time been ill for a long period of time. And so the HIEs have helped increase the robustness of the information we receive, have decreased testing, have also increased the ability to provide that continuum of care to the patient. And also the second benefit that was really spoken very highly of is the discharge process. When these patients go somewhere else, those providers that are taking the patient back into the community, the PCPs or specialists, they have access to the information that we have or that we have done clinically for those patients when they're inside of our facilities. So it allows us to decrease readmissions. It allows us to reduce the duplication of tests after they've discharged and increases the care and the continuity of that care. So those are real words from CEOs at hospitals that are actively engaged and involved in HIEs today. From the state of Montana's perspective, the only way that we will have a successful HIE and really accomplish all the things that we want to accomplish is to have all of our providers actively involved. Because at the end of the day, this is about providing good care for our patients and increasing the quality of the outcomes. There's really no other reason that we should feel compelled to get involved except to do the right thing for our patients. So with that, Kurt, I'll go ahead and pass it off to another member of the panel.
Thank you. Great, Judy. And I'm just looking at the picture on our Brady Bunch screen here. I'm just going to go right over to Dr. Lechner.
Thank you, Kurt. So I would echo, I mean, from the Blue Cross perspective, and I've been in a number of the different seats that would interact from this, you know, with an HIE, from being a physician in a practice, in a hospital administrator, and now for Blue Cross. So one of the, I guess I have a couple of points to point out and echo what Judy says. So one of the things we see as we work with some of our large self-funded employers are what happens with gaps in care and handoffs between facilities and the difficulties as we look at, you know, large, expensive, you know, claims for our self-funded groups. Many times that there is, you know, an absence of effective, you know, communication handoff at some point along the way for, you know, for our members and our, you know, Montana citizens. So that's, you know, that's an important piece I'd see that would be fulfilled within an HIE network. From an insurance perspective, from the Blue Cross perspective, we're very engaged in value-based, you know, care and quality management and incentive management around quality, better care, better outcomes. And we are constantly looking for records and information. I'm aware other insurance plans, similar sorts of challenges, getting what they need to help with their quality programs, their HEDIS scores, their STARS reports. And we too have a large employed group of folks, some of which are nurses, to also do this data chase from the different facilities. A number of organizations have hired outside contractors to chase records as well. And as a result, there's a fair amount of abrasion, you know, for the record producers, the facilities, the providers, et cetera, for these efforts. And that's, you know, we'd like to reduce any of that abrasion, you know, as well, but also improve the access to the information so that we could better turn around, you know, quality reports, work more in real time with the facilities, the providers around, you know, gaps in care opportunities for them to close for their own self-funded, you know, programs, which most of the hospitals are, not to mention how to work with them with the large employers in their areas. So these are, those are some of the main reasons I see just off the top of my head, Kurt, as to why, you know, an insurance plan would be interested in supporting this.
Excellent. Thanks, Dr. Lechner. Dr. Mark, let's kick it over to you.
Sure. Thanks, Kurt. We're a federally qualified health center, and in the eastern part of the state. We're not a large organization, but we have about 35 clinicians. They're scattered, you know, across 5 different counties. And at each of our sites, we interact with a variety of stakeholders, from hospitals to public health departments to long-term care facilities. And so we encounter the same issues that all of us caregivers face in terms of gathering information. And that issue is just magnified given the breadth of our geography. So probably the most compelling value proposition for us as a health center is simply what we've all been talking about in terms of consolidating information and ease of access for our clinicians. What we're noticing is that, in a number of our sites, we interact with Indian Health Service hospitals and clinics. And one of the developments that we've noticed over the past 5 years since Medicaid expansion is that our tribal members have a lot more portability and choice when it comes to their care providers. And so we have a lot of patients that come to the health center who are accessing care at numerous different points points of care. And so the need to gather information in real time from multiple sources of care delivery is that much more real. So we're really excited about the HIE as a way to streamline that work and make it much more efficient and effective for our caregivers. But one of the points that you made, Kurt, in your presentation is one that we're pretty moved by as well, which is I think we're all very sensitive to the notion that recruitment and retention of our clinicians is a huge issue for Montana. And so we're always looking for ways to improve the experience that our clinicians have on a day-to-day basis. So anything we can do to minimize that sort of death by 1,000 paper cuts experience of tracking down records is something that we're going to jump on immediately. And so we find that almost as equally compelling as the actual just getting information, facilitating that process as well. So we're really excited. We didn't make the first 6, but we're going to be jumping on here in the next couple of weeks, and are really eagerly looking forward to using the HIE that we've long sort of dreamed about.
Excellent. Dr. Mark, thank you. Dr. Harrop.
I always forget to unmute myself. If I'm at the end of the line, do I get to just say ditto?
No, you're not at the end of the line, and you don't get to say ditto. So there you go.
Very good. So I'm first and foremost a practicing physician, a primary care physician, and I own my own practice. So what's really important to me is good quality care of patients. I live and work in a unique area where there are four health systems who take care of all the same patients, and they hop around all of the time. And when you're employed by one, you don't have access to the other, et cetera, et cetera. So it's really important to me that patients get really good quality care and that I don't have to get 1,000 paper cuts looking for their records to be able to pull that care together. Because oftentimes they'll come into the office and say, well, I saw this doctor at this hospital and this one at this hospital, and now I have to sort out kind of what's the continuity story and what can we do to make their experience better. I would also just toss out there that patients are bearing more of the cost for their care. That's just the reality of the world that we live in. And so they care a lot about not having tests duplicated and finding a good deal on the studies that I recommended for them. So I think having an HIE to make sure that they haven't already had a study that I would suggest is really a valuable tool for me on a day-to-day basis right now today. I would love to be able to go to one place and get notes from the 4 specialists I've sent my patient to in the last couple of weeks. My other role, though, is as the CMO of the Physician Hospital Organization in Missoula, Monida. And our mission all along has been to make the practice of medicine and the business of medicine easier for our members. And so we recognize that the market is moving towards value-based care, and it's going like a speeding train. And so on behalf of the practices and physicians who are members of Monida, we all don't individually have the bandwidth to pull together the kind of data that we need to report and do well in a value-based contract. So rather than recreate the wheel 97 times for 97 different contracts, it's really important to have a centralized repository. So as a Monida person, I would say that having the Health Information Exchange as the place to go to get reports about quality data and gaps in care is beyond valuable. And I will stop bugging all of these practices that are members about making data integrations so that we can pull these things together for them.
Excellent. Thank you so much, Dr. Harrop. Well, thanks, panelists, for the discussion. I'm going to pause there, and I really want to give our guests today an opportunity to ask you panelists whatever questions you all might have. And it can be a question for a panelist or a question for someone from Big Sky Care Connect. But one of the opportunities we want to take advantage of today is having a group of folks together and hearing what your hopes are, or what your concerns are, or what you might be afraid of, so that we can really give you some transparent answers to your questions. So I'm going to ask you all to head over to your chat and be brave and type in a question. What are you curious about? What do you want to know more about with the Health Information Exchange?
Kurt, is it okay if I ask a question too?
You betcha. Jump in.
I'm pulling my brave hat on. So from the cost information that you provided, it clearly kind of represents what burden that the hospitals and practicing physicians will put into maintaining the HIE. And I think that's valuable, that we all feel like we have some ownership of this data that we're putting into it. But the outcome of the HIE, the data that comes out of it, doesn't just benefit physicians and hospital organizations. It benefits payers too, and it benefits a variety of other people. Do you have any sort of graphic that demonstrates how that load is distributed across the different stakeholders? Or is it all just hospitals and clinicians?
We sure do. And that graphic, if I'm not mistaken, was actually shared in the chat earlier from Young. So there is an attachment right in your chat bar. It says BSCC cost and ROI, and I am going to click on it, see if it works. And I'm going to share my screen and show that to you. So here's what we have is the shared funding plan looks like this. It's close to a third, and a third. And so we've got the state of Montana, which are state and federal agencies, payer community, and the provider community. And so you can see there how those are split out. The provider community and the state are each contributing approximately 1.4 million, while the payer community is contributing approximately 1.6 million. Does that answer your question, Dr. Harrop?
Kurt, we have a really good question here about any case studies or examples of other states who have done this successfully and have done this well.
Oh, yeah, that's a great question. So I'll start off before I hand this question off to someone else by saying that a timely question, our next webinar, which is next Tuesday at noon, is going to be twofold. It's going to be an opportunity to take a look at the technology, so you get to see a demo of what will our HIE actually look like from both InterSystems and from Collective Medical Technologies. And we've also invited some guests from other states to actually come talk to you all about their real-world experience. So we hope that you'll join us Tuesday for that as well. But I do think we can talk about that a little bit. And Jeanette, I think I'm going to start by handing this back to you. You've implemented health information exchanges in several other states, and maybe you can take a stab at this, and then we'll see if our panel has any thoughts.
Well, Kurt, if you, the slide that you presented early on in your presentation that talked about the benefits of an HIE, we do have studies to back each of those statements. So when we talk about savings, improvements in case mix index, when we talk about decreases in administrative burden, or efficient ED utilization, or the drop in readmission rates, each of those statements is backed by studies that we can share with the group. So what we did in putting that slide together was pulled the research and came up with that list.
Excellent. Thank you. And how about from our panel? I know that some of you have talked to other state HIEs in the past and been exposed. So any thoughts about that question? What do we know from other states' HIEs?
Kurt, this is Judy Powers. I just want to share with you that when I asked the question of our HIE technologist at our corporate entity, the state that came up as one of the really leading edge that works with InterSystems was California's Manifest MedX HIE. They talked a lot about the integration and the fact that it's being utilized at a much higher level than they've seen in some of the other states.
Excellent. Thanks, Judy. And I hope that you'll attend next time, where you actually get to hear firsthand from some other folks. So it looks like we have another question, Kelly.
That is correct. Are there any specific data requirements to connect the HIE, especially if you do not have an EHR that is very robust?
And I can answer that question, Kurt. Again, this is Jeanette.
Thanks, Jeanette.
Yes, we do have, well, as we said before, our motto is we meet you where you are. We do have, Kurt had a slide on some of the data standards that we follow. So HL7, primarily for individual message types, but we can also accept continuity of care documents, CCDs, that your EMR might be able to generate, or we can look at more simplistic ways of being able to transfer data. And then we also have the ability to send information around securely using direct secure messaging. So we do have many options that are available regardless of the capabilities of your EMR. And we also have the technical resources to help us do that work.
Excellent. Thanks, Jeanette.
Great. Jeanette, you may be able to answer this one also. How is the hospital onboarding proceeding?
I'm not sure I understand exactly. Are you asking how it's proceeding with the 7 organizations that we're currently working with? Is that the question?
I would assume that that is what the meaning is.
Yeah, so yes, along the timeline to join. Okay, sure. So Cabinet Peaks we just signed yesterday, so that's just in the very beginning stages. The 2 that are most furthest along, I would say, are Billings Clinic, where we're actually starting to get data into the system and starting the testing. And then as well with Medicaid, we're making a lot of progress in terms of being able to get the data into the environment. So all of those organizations are in the early stages of technical discovery. And like I said, Billings and Medicaid being the furthest along in those implementations. If you're asking about the onboarding process in general, there is a high degree of variability depending on a number of factors, including what your priorities are as an organization, the kinds of resources that you have in terms of support from your EHR vendor, the capabilities of your EHR vendor. But typically you're looking at probably a 1 to 2 to 3 month timeline to get onboarded. Again, depending on all the different variables that I just outlined.
Excellent. Thank you.
Okay, and it looks like in our chat, Young did provide a link to Missouri's Health Connect and the benefit of the HIE if you guys are interested in checking that out.
Excellent. Thanks, Young. See, I told you these guys were awesome. They're great. So one of the questions that has come up a lot to our panel that I want to ask you to discuss before we finish today is because of the past that I talked about, that people can be a little bit hesitant and sometimes just talking about healthcare technology makes us nervous, right? And implementing some new healthcare technology sounds like it's a lot of resources and opportunities for things not to go well. And so it might be easy to just say, I'm going to sit back and wait. I'm going to wait and see if this is actually going to work before I commit and sign on and contribute my data. And I want to hear from your perspective from a statewide health information exchange. What would be the risks to our HIE if enough hospitals just say, I'm going to wait and see how it goes? Judy, I'll start with you again.
Thanks, Kurt. The risk is the value and the robustness of the information. That's the first and foremost risk. So I think it puts our patients in that continuum of care that all of us panelists talked about at risk. The second thing that we are at risk for is, as a provider, the current structure and financial support that we get from the 90/10 high-tech funding can be at risk as well. So let's say in a year, we decide as a provider, you might not be able to tap into as much funding to help you ensure that those connections happen in a timely manner. Again, the very first one is the more altruistic patient information. If you have a patient that's being seen at multiple different places and you're missing one of those, it does create that gap in care that Dr. Harrop talked about.
Right. Thank you, Judy. Dr. Mark.
Yeah, I just think it's pretty clear that this is the case, that the more of us that participate, the better the product, and the more benefit we all derive. So it is a case for altruism, and but it's sort of selfish altruism in that the more of us that do it, the better we get. So the better the product. So I would encourage all of us to really think of it as a phenomenal tool to improve patient care, and one that will get better the more of us that do it.
Thank you. And Dr. Harrop, I know you have some thoughts about this.
So I would just throw out there the tyranny of small numbers. As we're all working in value-based contracts, whether it's CPC Plus or the ACO or whatever contract might come down the pike, if we don't have enough population health data, because Montana is such a huge state and we really don't have that huge of a population, even just a minor skew in the data makes us look like an outlier, and that can be detrimental to all of us moving forward as we interact with payers and government entities that feed us.
Yes, excellent. Thank you. Thank you very much. Dr. Lechner, are you there?
I am. So my technology challenges are over, but no video. So 1 out of 2 ain't bad. So it's similar, we have an excellent care delivery system in Montana. We have incredible hospitals, incredible physicians, and I don't think we should put our population at risk for not having a good exchange. I think if it were to fail this time, it's never going to happen. It's the best effort of the 3 that I've seen, and I've been involved with all 3 of them. And we're really at a point we can't allow this to fail, because we need to be state of the art. And this exchange of information is critically important to the longevity for our fellow citizens. The care is across the state. As a rural state, you're able to provide some of the specialty care in your community. A lot of it is not in your community. Even the larger communities are still seeing an outflow of patients for different care. And I see even better now, sitting in the chair at an insurance company, how those gaps really do translate for cost and morbidity. And we can't continue this we have the opportunity now to put this behind us so we can move forward with better care and truly showcase for our how excellent the care is in Montana.
Thank you, Dr. Lechner. So I'm not seeing any other questions in the chat, panelists. And before we kind of conclude here, I would like to just give you an opportunity to talk about whatever it is that you want to talk about. Any additional comments, thoughts, or conclusions from our panelists? And Judy, I can just start with you.
Yeah, this is Judy Powers. My thoughts are that we are in a time where our world is very small, and this pandemic that we're in the middle of has shown us how communication between healthcare providers, population health, the needs of our citizens of the state of Montana, as well as the entire country, have to be at the forefront of our mind all of the time. And it's in our best interest to step forward and do this as a state, and do this as a collection of individuals who care about the care provided in this state. It's our responsibility to be really aggressive about making this happen. Now, you asked about the risks, and I think the one risk that we have is that our rural communities, our critical access hospitals, our independent providers are out on an island, and our larger provider groups that may have a lot of care that are provided within their system, they have an added advantage that the rest of us don't have. And so help us experience that by shrinking that technology need throughout our entire state. Let us have one health system, and that's the system of the state of Montana, not each individual provider group in and of themselves, which we do a very good job within those individual provider groups. So we need to shrink the world within our state, and that'll help us provide better care and have better outcomes.
Thanks, Judy. Dr. Lechner, any final thoughts?
I don't think anything further than what I had said. So no, this is a great group of panelists with great perspectives, and I just echo what they've said.
Thank you. And how about from Dr. Harrop?
I would just put all of my thought behind what Judy said about all of us working together for improved health amongst all of the citizens of our state.
Excellent. Thank you. Panelists, I just want to give my deepest gratitude. As you know, you agreed to come on and be panelists today on very short notice, and your commitment to the health information exchange is just stunning, and thank you for your time today. For the rest of you that participated, thank you so much for joining us. Remember that we do have another webinar scheduled for next Tuesday at noon. And if you would like more information, we would just ask that you reach out to Big Sky Care Connect through our website, through our phone number, through any of the information that you've seen today. And I'm going to go ahead and put that information up on your screen right now. As I said, Young, Stephanie, and Haley are waiting for you to reach out and just serve you really, really well. So please feel free to contact any of us at Big Sky Care Connect, and we would be happy to visit with you, prepare a presentation for your organization, and get you started on the health information exchange. So if there are no other questions, we can conclude for the day. If you would like to stay on because you have some questions, the Big Sky Care Connect folks are going to be on here for the next few minutes. And so if you want to stay on and unmute and chat with us for a couple of minutes, we're going to make ourselves available to you. Otherwise, you all have a wonderful Thursday. So thank you all, and we will see you next Tuesday.